Bhagwan Sri Sathya Sai Baba was admitted to this hospital on 28th of March with the complaint of slowing down of heart and the little what we call intermittent cardiac block. He was immediately rushed to the cardiac catheterization lab of this hospital along with the doctors, and he was given a pacemaker and angiography study of the heart was done. After the procedure was completed, he was admitted in the special ICU and was watched carefully by a panel of doctors of this hospital. Later in the day, he started developing slightly lower blood pressure, which was persisting, and to remain low. In order to bring up the blood pressure, an intra-aortic balloon was fitted up into him in the cath lab again, where he was shifted to. In the cath lab, Swami tolerated the balloon very well, and the blood pressures and the cardiac condition improved remarkably. He was taken back to the intensive care, where he was closely watched again by the panel of doctors. By this time, the hospital panel of doctors wanted some help from outside, and specialists from Bangalore were flown in to help them and to guide them. So this continued. The intra-aortic balloon was later on removed. Swami was progressing well, but his basic muscular weakness and lack of effort on his part to throw out the sputum led us to the only way of putting the tube into his windpipe, so that through that tube we could suck the excretions which accumulate in the lungs. If we allow these excretions to accumulate in the lungs, chances of infection and pneumonia develop in the lungs rapidly, which can adversely affect the life of the patient. In order to avoid that, he was intubated and connected to a ventilator to give rest to the lungs. As the procedure was going on, we discovered that gradually the urine output was also going down, giving an indication that the kidneys are also gradually not so effective as they should be. And therefore, it was necessary to assist the kidneys, because otherwise the toxins in the blood could not be removed. It is the job of the kidneys to remove these toxins and to remove the nitrogen products of metabolism from the body. Therefore, dialysis was contemplated and a dialysis was done. And after this dialysis was done, it was felt that this dialysis will be needed for a longer period, because kidneys did not show immediate response. As a result, a process of dialysis, which is now put into the practice by the most of the advanced centers of intensive care, is known as CRRT. That was put into the practice, and this machine does a very slow dialysis continuously for longer time. So in that way it differs from the hemodialysis which Swami had undergone earlier. And in order to let the kidneys revive completely, it was necessary to put on this device on which he was functioning till today morning when again hemodialysis was done because it was felt that the toxins were not completely being removed by the slow dialysis process. And then we did a hemodialysis with intervention of certain filters and discs through which the blood was passing through, and the result was that the toxins were removed quite a bit. And these discs also have impregnated antibiotics which are specific for the type of infections which such patients develop. And these type of dialysis showed quite good results in the sense that the lung infection cleared quite a bit and his consciousness level improved. And in the morning today, he was quite responsive to the outside stimuli, and because of the tube in the mouth and tubes around, he could not talk, of course, but he was nodding his head and responding to our queries. So this was a very good development, and the doctors felt encouraged. And that is the condition now. He is in a pretty stable condition with a stable blood pressure, stable respiration rate, blood gas analysis. The status of oxygenation of the body is also very good and maintained. And the level of electrolytes, sodium, potassium, etc., is also fairly well. Blood gases are also very comfortable. Therefore, we have a hope that the crisis will be tided over. Although I would say that Swami still continues to be in a critical sense of health. So the efforts of the doctors are going on and shall go on, and he is being constantly, every second, watched and monitored by the doctors and by the machines. There's no question of any letdown in that respect. And it is not only the team of doctors from this hospital that is working on him, like Dr. P.K. Das, Dr. Iyer, Dr. Neelam Desai. They are the doctors, senior doctors and reputed doctors in their own way for the cardiology and cardiothoracic surgery. Dr. Prakash Nair and Dr. Shinde and Rita, their assistants. And for the intensive care, Dr. Krishan Dasan and his team, consisting of Dr. Rajan Anand, Dr. Patnaik and Dr. Ranga, are doing a wonderful round-the-clock job of watching over the conditions of Swami. Besides this, large number of about 14 to 15 doctors from outside have been consulted who have been either flown in or have come through the car to this place. I would like to mention particularly Dr. Venugopal, the former director of AIMS New Delhi, a famous cardiothoracic surgeon of the country, and Dr. Ashok Seth, again a famous cardiologist of the country from Escorts, New Delhi, and Dr. Sandeep Devan, also from Escorts, New Delhi, who is a very well-known intensive care specialist, and Dr. Amit Verma, also from Escorts, Dr. Subhash Chandra of Cardiology from Manipal, Bangalore, and Dr. Uday Muthani, nephrologist in the Parkinson Foundation, Bangalore, and Dr. Ravi Mehta, intensivist of the Fortis Hospital, Bangalore, and Dr. Arun, the nephrologist of Vaidehi Malaya Hospital, Bangalore, Dr. Kishore Babu, the nephrologist and of the Vaidehi and Malaya Hospital, Bangalore, Dr. K.S.R.K. Prasad of ophthalmology, and Dr. Mudgil, gastroenterologist from United Kingdom, and Dr. Narendra Reddy, endocrinologist from California, USA. This is the panel of doctors from outside who have been consulted by our native doctors team, who are working round the clock, every second, every minute, for the love of Swami, for him. At this point, I must mention that we are grateful to the government of Andhra Pradesh, sent a team of doctors, 4 specialists headed by the Director of Medical Education of Andhra Pradesh government to look into the treatment part of Swami, which he is undergoing in this hospital, and to suggest any improvements which they could think could be incorporated in the overall treatment. In fact, it was Dr. Ravi Raju, the Director of Medical Education, who suggested that it was better to put Swami on the CRRT, and that suggestion was immediately incorporated in the process of treatment of Bhagwan Sri Sathya Sai Baba. And we are also grateful to them to keep a liaison officer over here. Dr. Ashok Kumar is over here with us, who is collaborating with our doctors and transmitting the day-to-day information, minute-to-minute information, event-to-event information to the Director of Medical Education, and receiving valuable guidance from him from time to time, which our doctors are looking into, and is providing them help. This is a very welcome gesture on their part. While all this is going on, Swami's illness is a great shock to his devotees and to doctors of this institute, who are also his devotees plus professionals. And the sole reason for not allowing the everybody to come into the hospital is to keep the environmental hygiene of the hospital perfectly under control, particularly in the ICU. Nobody is permitted where the treatment of Bhagwan is being done. So because the purpose is very, very sacred, and that is not to increase the complications, medical complications because of infection. And we would be very much grateful if the public understands it, if the devotees understand it, and not try to pressurize and put all sorts of trespasses into the premises of the hospital. In this case, I may mention that even the very important persons coming to meet so as to inquire about the health of Bhagwan Sri Sathya Sai Baba, they cannot enter the nearest area of the intensive care where Bhagwan is undergoing the treatment. We make it possible to make them meet the doctors concerned or the head of the team or myself. We brief them, and they leave the hospital quietly. This all is important from the point of view of infection, which can destroy any good work done by the doctors. And we all feel proud, along with my doctor's team, to be able to serve Bhagwan in this hour of his critical health.
From the time Swami came to the time now, do you feel he is in a much better condition now?
Yes, I would feel so.
And we can, I suppose, positively look forward to seeing him back to normal in the not too distant future.
The response since morning has been very encouraging, and I would feel that this will definitely happen.
Thank you.